Hi, everybody, and welcome back. This lesson is going to be understanding the International Classification of Functioning, otherwise known as the ICF, which is the International Classification of Functioning, Disability, and Health. We're going to be diving in a little bit into that this lesson and talking about what that means. And this is something that is used across all disciplines in healthcare, so just something important and good to be aware of. So looking at what is the ICF, so it is a framework for describing the facets of human functioning that may be affected by a health condition. So just to clarify, it is a classification system and not a measurement tool. So this is not a specific, like we're talking about different tools that we're using for assessment and documentation. This is a classification. You wouldn't use this as a way of measuring a level of function or disability for a participant. So the ICF was developed by the WHO, or the World Health Organization, which is the largest international multidisciplinary participation agency, and it has undergone extensive field testing. So that's something important. This is, again, universally kind of accepted and identified across the medical fields. So the purpose of the ICF is to provide a scientific basis for the consequences of health conditions. It's also to establish a common language to improve communication among healthcare professionals. So again, this is kind of making sure it's kind of uniform across the board, so everybody is able to talk about a certain condition, physical, psychological, and everyone's able to kind of understand what that means, whether you're talking to somebody here or in another country. Its purpose is to provide a systematic coding scheme for health information systems, which we'll talk about in further slides. And it's also to permit comparison of data across different countries, as I had mentioned, healthcare disciplines, services, and time. So again, it's really providing a scientific basis for understanding the consequences of health conditions. Again, it's to establish a common language for communication across those healthcare disciplines, and it's to offer a systematic coding scheme for the information systems, just to clarify all of that. And it also allows the comparisons of data across countries and services and disciplines over time. So that's kind of a little bit more information about those 4 areas. So looking at health, the ICF goes beyond defining somebody's health just by their diagnosis. The ICF and the WHO define health as not just the absence of disease, but also examining well-being. So we're defining well-being as a state of optimal physical, mental, and social health. We can't just look at this as their diagnosis. We're looking at the fact that there can be many factors that can influence how somebody functions and their overall level of health. So human functioning, ICF does not measure disability. It describes a person's functional abilities in various domains. So this means that the health conditions that affect functional status are not part of the classification system. And as we know and have probably learned in other classes, disability is not an all or nothing concept. There's a wide range of functional limitations. The ICF is a universal classification of disability and health, named to stress health and functioning rather than disability. So really, again, ICF, health, functioning, not disability, looking at the consequences of disease and the components of health. So those are important things to keep in mind. The application of the ICF can be at the individual level, at the institutional level, and at the societal level. So at the individual level, we're looking at the person's level of functioning, their treatment and outcome measures, communication, and self-evaluation practices. At the institutional level, we're looking at educational and training purposes, resource planning and development, quality improvement, management and outcome evaluation, and research purposes. And then at the societal level, we're going to look at this as the security purpose and insurance benefit, the social policy and legislative purpose for universal designing and environmental modifications. So those are the three areas that we're going to be applying the ICF potentially throughout our discipline. So next we're going to go in depth to a little more of an overview of the ICF. So there are many factors, as we can see from this diagram here, to consider when determining an individual's level of health beyond their diagnosis. Again, as we've mentioned earlier in the slides, a classification of health and health-related domains that help us to describe changes in body function and structure. We're looking at what a person with a health condition can do in a standard environment, and their level of capacity, as well as what they actually do in their usual environment, which is their level of performance, as we can see below. These domains are classified from body, individual, and societal perspectives by means of two lists: a list of body functions and structures, and a list of domains, activities, and participation. So we're going to see that functioning refers to all body functions, activities, and participation. Disability is an umbrella term for impairments, activity limitations, and participation restrictions. The ICF also lists environmental factors that interact with all of these domains. So first, we're going to talk about health condition. As we can see, that's our overarching thing at the top. This can be an acute or chronic condition from injury, aging, genetic predisposition, or even pregnancy. The ICF encompasses all aspects of human health and health-relevant components of well-being and describes them in terms of health domains and health-related domains. These do not cover circumstances that are not health-related, such as factors as race and gender, etc. People may be restricted in their execution of a task in their current environment, but these are not health-related restrictions of participation in the ICF. Now we're going to go on to discussing the body functions and structure and activity participation. So that's this area right here. So individual, we're looking at the body function and structures, and the societal perspective is activities and participation. So more specifically, looking at body functions and structure. Functions are physiological factors of our body systems, and structures are anatomical parts such as organs and limbs. Impairments are problems such as loss or deviation in function or structure. So again, this slide kind of breaks that down. Body functions and structures. Functions are the physiological systems, structures are the anatomical parts. So that's just this slide what I just talked about right here. So functional abilities and impairments are not linked to a cause. So for example, fluency and rhythm of speech functions could be from stuttering, a stroke, or autism. So there isn't always a direct link between functions and the structures that we're looking at. Body functions and structures encompass a number of chapters as outlined above. A person could describe impairments in physical structures or impairments in the future of the structure. Many of these domains have never had a unified language applied to them. So functions, once again, physiological functions of body systems, structures, anatomical parts of the body, such as organs, limbs, and their components, or the whole systems. So as we can see, this is kind of a breakdown, kind of what the ICF would look like. We're looking at the body function, the body structures, and then it lists either of these on either side. So you can go back and review these, pause, or kind of look at this, especially as we get into later looking at how we're going to classify our different different systems through the ICF. So then looking at activities and participation. So activities and participation describes individuals functioning as a whole person as opposed to function and structure of their body parts. So this is going to go basic to complex. So example, a basic skill is dressing, eating, and bathing. Complex is things that are going to take up more bandwidth, which is work, schooling, and civic activities. Unlike we might perceive from the term activities, like a recreational activity that we may think of when we're facilitating a group or a program, activities under the ICF are more discrete. Activities within the ICF refer to the specific execution of a task, like manipulating objects, focusing attention, or walking on different surfaces. Activities are what people can do inherently without assistance or barriers. So that's what we're talking about here in relation to activity. Participation includes moving around within a facility or using transportation. So participation, functioning, we're going to be taking into account the impact of barriers and facilitators into the environment. So we can also look at participation restriction, which are the problems that an individual may experience in involvement with life situations. Continuing to look at activities and participations, what is most important is that there's a range of activities going from basic to complex. That person describes an ability to live independently and be integrated into their communities. So the chapters related to activities and participation are pretty comprehensive, and they include all activities of daily living, or ADLs. So as we can see, they're listed right here. Activities in their corresponding chapters. So continuing down our chart, next we're going to look at environmental factors. These include products and technology, natural environment, and human-made changes to the environment. They support relationships and attitudes of others and services, systems, and policies. The ICF presents 5 domains of environmental factors. Again, so these are listed here: products and technology, natural, environmental, human-made changes to the environment, support and relationships, attitudes, services, system, and policy is the last one. So we're going to break those down a little bit further. So the 5 domains, so products and technology is the first one. This is going to introduce clients to products and devices that can increase functioning and quality of life. Looking at the natural environment and human-made changes in the environment, it's going to provide a safe and healthy environment for clients to exist in. Support and relationships, it's going to be ensuring that the client has social support. Attitudes, we're going to be an advocate for individuals with disabilities and education of others. And finally, with services, systems, and policy, we're going to advocate for accessible service, understanding what rights people have, what public services are available, and so forth. So, and then personal factors. The ICF does not classify these because of the large social and cultural variance within them. So there could be a wide variety of things that are different from how we view personal factors in America versus another country. Personal factors would include an individual's demographics, age, gender, ethnicity, and through these factors are obviously really important to us as recreation therapy or other medical field professionals. It's important. They are still factors that are important to consider when we are working with clients. So getting more into the ICF classification and coding. This is going to show us a little bit more of how to code and what an ICF code actually looks like. So the component are sort of listed here. So the S is going to be body structure, the B is going to be our body function, the D is going to be the activities and participation, and the E is going to be the environmental factors. So again, this right here is going to show us a little bit of a breakdown of how we're going to be looking at that within an ICF system. So related to ICF classification and coding, again, the categories are going to be the basic aspects of the classification, and they're organized by the digits, first, second, and third. So the next thing we're going to be looking at is qualifiers. So qualifiers are ratings which are assigned to each code, and the qualifiers are recognized as essential to the meaningful use of the classification because of the domains and the codes are expressed in a neutral language. So without qualifiers, the codes wouldn't have an inherent meaning, and that's based on the WHO's classification system. So looking at the overview of codes and their qualifiers, each component has a letter associated with it. So the qualifiers are listed below each component. So it'll, as you can see down here, body functions, body structures, activities and participation, and environmental. The environmental codes also have qualifiers associated with them, but they will not be fully explained here because they're described in a different format than the other qualifiers. So continuing on with our conversation about qualifiers, the percentages are meant to provide a guide to the magnitude of the problems. The person is compared to the general population. Not specified is going to mean not assessed, and not applicable means it may not be relevant to the situation or appropriate to assess for the situation. So as we can see down here, the three components classified in ICF, the body function, activities and participation, and environment, are quantified using the same generic scale as we can see listed here below. So looking at qualifiers for body structures is the extent or magnitude of an impairment. So these percentages are meant to provide a guide to the magnitude of the problem. The person is compared to the general population. Not specified, again, is going to mean not assessed, and not applicable is going to mean that it's not relevant for the person in the situation. Again, same as before. The next is qualifiers for body structures. That's the second qualifier, which is the nature of the change in the respective body structure. So it's on a 0 to 9 scale. The third qualifier indicates localizations of the body structures. So you can see again, 0 to 9, starting at 0, more than one region, 9 being non-applicable. And then the A and P qualifiers, which are based on performance and capacity. Performance is what a person does in their current environment based on their lived experience, and capacity is what they could do in a standardized environment without barriers. So this is going to indicate the highest probable level of functioning in a given domain at a given moment in a standardized moment. So the three capacity and performance qualifiers are classified into activities and participation, as we can see below. 0 is no problem, 9 is not applicable, and then everything in between. And then this is how a website where you can go to independently when you're done with this lecture, where you can access the ICF. So you can go ahead and use this link. And you can also do some practice. So if, for example, if you want to code body structures, the impairment of a person with moderate hemiparesis, mainly in the left ankle foot region of the lower limb, you're going to want to type in the search ankle and foot, and then S7502-S75022. So that's how you would do that if you want to go back at home and practice on your own. And then you can see here, so the S75022, if you search it, the first number is going to be the extent of the impairment as the first qualifier. The nature of the impairment is going to be the second qualifier, and the location is the third qualifier. So just based on our example, 75022.222, this is going to be our first, second, and third qualifiers. And that's going to be based on the impairment of a person with hemiparesis, mainly in the ankle or foot region of a lower limb. When you're coding activities and participation, so the performance of a person who is having less power in his left leg due to hemiparesis and since then has used a cane but faces moderate difficulties in walking around because the sidewalks in the neighborhood are very steep and have a very slippery surface. You're going to look up walking short distance. It's going to be D4500 if you're using that link. So again, D4500, the performance qualifier, that first qualifier, the capacity is going to be the second qualifier without assistance. And we can say that moderate restriction in performance of walking short distances for the capacity qualifier, this domain is going to refer to the individual's ability to walk around without assistance. So for example, we're going to say the true ability of the individual to walk without a cane in a standardized environment, such as one with a flat and non-slippery surface, will be very limited. So again, we can look at that, 0 to 9 scale. Moderate restriction in performance of walking short distances for the capacity qualifier. This domain refers to the individual's ability to walk around without assistance. For example, the true ability of the individual to walk without a cane will be limited yet again. So looking at D4500.23. So when we're looking at going back to our documentation and goals, looking at how to use the ICF in goal writing, the intervention or protocol assignment will require you to link your goals and objectives to the ICF that you're going to be doing this week. So the step 1 is you're going to research your condition or disease. Step 2 is going to be to identify potential outcomes. And then you're going to search through the ICF to make the connection. So that is going to be the practice that you're doing for your assignment this week.